Awaaz.com.
This is the morning brief from the Economic Times, produced in collaboration with Awaaz.com.
I would like to take my mom out because I feel really bad for her because she's been more than me and dad. She's been completely at home. She's not gone anywhere, maybe somewhere nearby for a small holiday.
The one thing I would do, I think it's the traditional one. I would like to travel more. I would like to travel to places where there are more touristy places where otherwise I wouldn't.
Honestly, I would just like to get my life back on track in terms of, going to work every day or, going to the local restaurants. Basically, just resuming life back on track.
What you just heard were a few of the responses of people under the age of 45 years when I asked them what they would like to do once they were vaccinated and had developed immunity for a feature that I was writing. These conversations happened 2 weeks ago when none of us were sure when people under 45 would get the vaccine. Now, with the government opening up the vaccination drive to everyone over 18 years from the 1st of May, those wishes look just a little bit closer to becoming reality.
वैक्सीन को लेकर हुए एक और अहम फैसला भी हमने किया है। 1 मई के बाद से 18 वर्ष के ऊपर के किसी भी व्यक्ति को वैक्सीनेट किया जा सकेगा।
But even as vaccines appear to be within reach for a lot more of us, once you go beyond the headline of vaccine for all adults from May 1st, a whole bunch of questions emerge, from whether there will be enough doses to meet the likely surge in demand, to how much we will have to pay, to whether distribution will be equitable. That's what we'll try and find out in today's episode. I'm Indulekha Arvind, and this is the morning brief from the Economic Times. To try and get answers to some of those questions, I've invited 2 experts. The first is Dr. Gagandeep Kang, Virologist and Professor at Christian Medical College, Vellore. Dr. Kang, as some of you may know, was the first Indian woman to be elected to the Royal Society of London. She is joined by my colleague Nidhi Sharma from the Political Bureau, who has broken several stories on the supply and distribution of the COVID vaccines to various states. Good morning, Dr. Kang, Nidhi. Great to have you with us.
Thanks, Indu. Thank you, Indu.
Dr. Kang, let me begin with you. After following a phased vaccination strategy from January 16th, the center is now liberalizing vaccination, which is something that some companies, individuals, and political parties had been asking for. But as someone who works with vaccines and viruses, is this the right step at the right time towards ensuring better coverage and protection for the population?
So I think while making vaccines available to everybody is the ultimate goal of every vaccination program, we need to do this in a phased manner when there are supply constraints. And in order to have a strategy, it's very important to define what the goals of your vaccination program are. Are they to try and prevent as much severe morbidity and mortality as possible? So protect people from being hospitalized or dying? Or is it to arrest the spread of the pandemic? Both of these are very, very worthwhile goals. But in general, in the prioritization frameworks that have been established around the world and the prioritization framework that was developed in India, the goal was to try and protect people from hospitalizations and death. If that is the case, then it makes sense to saturate vaccination by age strata because we know that risk increases with age. So I would have liked to see a much more intensive age descending strategy where we try and cover each age group, no matter how remotely located they are, to try and protect them first and then come down by ages.
Sure. And the strategy, as you mentioned, is something that countries like the UK, for instance, have been following very strictly, right?
That's correct. In almost all parts of the world, it's been decided that the prioritization framework is to address those most at risk of infection first and those who are required to maintain health systems, so healthcare workers. And then following that, to address the issues of the most vulnerable in each society, which is the elderly and those with comorbidities. This is, of course, in a situation of constrained supply. Indonesia had decided to take a somewhat different route and try and immunize younger people as well to contain spread of the virus. But every country needs to make its own decisions and then communicate those clearly.
Now, apart from the age, another new factor in the announcements was, of course, supply and distribution, which had so far been centralized with priority to vulnerable sections. But now half of what manufacturers produce will be available to states and private players who have to procure these doses on their own. You're familiar with how vaccine rollouts have been happening in this country. How do you see this particular policy playing out?
Vaccine rollouts usually happen with a product which is licensed, not a product that is under restricted use. And so far, we don't have any fully licensed products in this country. So it's a little difficult to compare this rollout with previous rollouts. Whenever we have introduced vaccines into the routine immunization program, the government has been one step behind the private sector. Usually, we have had that vaccine available from multinational manufacturers and being sold in the private market and given by private doctors and clinics to people who can afford to pay for the vaccine. And then the government decides that this is a vaccine that is required for the entire country and rolls that vaccine out. And usually, again, that is from an Indian manufacturer, very rarely from a manufacturer located outside of India. So what we are seeing now is very different from what has happened before. And I guess we all have a lot to learn. In terms of the announcement that was made about the availability of the vaccine to the private sector, to states buying the vaccine, all of this is pretty new. So if we want something that is sustainable, that is intended to reach the entire population, the only examples we have are of routine immunization, where it has been central purchasing, and then the center decides which state gets vaccines according to its needs. So in phased introductions, a list of priority states will be drawn up, and those states will be provided all of the vaccines that they need. I don't think there has been a situation before where states have been asked to buy the vaccine for 50% of their population or their priority groups, nor has there been a situation where the private sector has been told that they can buy vaccines for particularly products that are not yet licensed. I'm not exactly sure how this is going to play out in terms of regulatory approvals, in terms of pricing, and in terms of liability once these vaccines start to be used.
Let's hope we get some clarity on that in the days ahead. But Nidhi, do we have clarity on how states will get the vaccines? I mean, will it be up to each state to negotiate with the manufacturer for doses? And will they then be competing with private hospitals and other private players like large corporates for the same pool?
Yes, Indu. The initial details that have been shared, even in the policy document by the Health Ministry, clearly says that 50% of the supply every month that is released. So 50% of the supply would be kept by the Government of India to sustain its public immunization drive, which is running for 45 and above. And the remaining 50% would be what that kitty would be shared between the states and all the private hospitals. Now here there's one more thing, that the foreign already approved vaccines, the foreign vaccines that the Government of India would not be using in its public immunization drive and will completely leave it to the states. Here, what the center is trying to do is get the market forces in play, thinking that even with the very severe supply constraints, if there is more, more consumption, maybe the with the incentivizing of the private companies, they will scale up their supply and to match up the demand. So that is exactly what they are doing right now.
Sure, but even here, the states will have to kind of individually negotiate, right? With even if it comes to foreign supplies.
Yes, for every thing for to run their 18 to 45 drive, it has been left to the states how to maybe, as Dr. Kang said, to scale down in an age appropriate manner if they want to, if they realize that they have, say, X number of doses which are not enough for their entire 18 to 45 population. What they can do is maybe introduce 35 to 45 initially, and then go down as far as vulnerabilities are concerned. So yes, they have to first compete with each other, because everybody knows that there are severe supply constraints, and then they also have to see their budgets, in the sense that these are going to be expensive vaccines, because since the center has removed itself from the entire play for 18 to 45, they are no longer going to be subsidized at, say, 157 rupees per dose. They are going to be more expensive, and who's going to foot the bill? So that is the entire thing.
Dr. Kang, what should the government now do to ensure equity of distribution and adequate supply, in addition to the announcements that they've made?
At this stage, when we talk about delivering vaccine to 45 and above, it's a central directive, but it's still state execution. So are we thinking about creating a two-tiered system for states where they treat the 45 and above differently based on the vaccines that are supplied to them by the central government, and then they have a separate approach that they need to take for below 45 using strategies that are as was described?
At this point, that sounds like it might possibly lead to some confusion. But again, we'll just have to see how they go about doing that. But Nidhi, your front page story on Wednesday says that the center will no longer supply vaccines to private hospitals, even for those above 45 years. Considering some states were already facing shortages, as you yourself have reported, will the new policy affect the ongoing vaccination drive for those in the priority category? And secondly, do we know whether people below 45 can still get a free dose in government facilities?
Yes, Indu. So the government has said in its policy documents that the entire thing, that entire policy of supplying to private hospitals will, their words, cease to exist. That means what we used to get in private hospitals at 250 rupees, they will not supply. So from May 1, if you are up for your second dose in a private hospital, you have the choice of going to a government hospital and getting it for free. So in that sense, the vaccination of 45 and above remains untouched. But here again, we know that there are supply constraints. So how much can every private hospital tap into that 50% that is left by the center remains to be seen. So the hospitals will themselves have to contact the private manufacturers, see how much they can get, and then press that into play. Now, these will be more expensive. They won't be there at 250 rupees. So here it'll be a predetermined price which will be declared, and the private hospitals would be free to charge that predetermined price.
So, and do we know whether people below 45 can get a free dose in government facilities?
No, they cannot get a free dose unless the states declare so. Like some states have declared on Tuesday that it will be, even for 18 to 45, it will be free of cost, like Assam did so. And they said that it will be free of cost.
Meanwhile, there's another update coming from the state of Uttar Pradesh and Assam. In fact, Uttar Pradesh has now decided to offer coronavirus vaccine free of cost from 1st of May. And following Uttar Pradesh, even Assam has now declared that it is going to provide free vaccine to everyone above 18 years of age from 1st of May.
here for 18 to 45, it will be free of cost. They haven't differentiated, will it be free of cost in their own facilities, or will it be free of cost in the entire state, which would include private establishments. But then again, if they declare free of cost, which I don't think would be possible for them to declare for a private hospital, because they have a different supply chain and the state government is not supplying to them.
Sure. Dr. Kang, data shows that, average daily vaccinations had dropped last week, and overall India had administered about 9 doses per 100 people compared to 62 in the US and about 15 in Brazil. Additionally, there were also reports that less than 40% of our healthcare and frontline workers who were the first in queue have got both the doses. What else should we be doing to improve uptake of vaccination?
I think one thing that we need to understand is that this is adult immunization that is outside of any kind of routine program, which essentially means that for every person who takes the vaccine, you need to make sure that the message has reached that person and they have had the opportunity to weigh the benefits and risks of vaccination. And if this communication is done right, I think it's my firm belief that most people will choose to be vaccinated. The problem really is that when you have a very centralized approach to messaging, then it becomes very difficult for people to understand whether this is actually meant for them or not. So in the communities that we work with, a lot of the people in urban slums seem to think, this is not really a vaccine for us because this is not necessarily our disease. We had it, it's gone. We don't need to be thinking about it. So I think this is a situation where we really need community engagement in order to be able to increase the uptake of vaccines. And that only happens when you know what the networks of relationships and what the networks of trust are. So you brought up healthcare workers, and at least initially, there was a lot of doubt in healthcare workers' minds. These are unproven vaccines. Why are we being made into guinea pigs? Haven't we worked hard enough already? So there was a lack of clear communication on issues that laid out what is known, what is unknown, what is real expert opinion that is based on knowledge of prior vaccines. If we didn't do a good job with healthcare workers, can you imagine what doubts the community more widely might have? We need to be getting the message out about vaccination, and in parallel with the message, we need to make it easy for people to get vaccinated. Having crowded vaccination centers that run out of supply and inability to access information about where vaccines are available, all of those contribute to lower coverage rates, and I hope that we will address those quickly.
Absolutely. I mean, the lack of information about vaccines is something I've even heard about, urban, educated, even the younger population, that they don't, the same questions about, which vaccines do we take, what's better, etc., etc. And you're absolutely right in that those are concerns that, need to be addressed. Nidhi, to what extent, when it comes to supply, will the permission to import vaccines help?
Theoretically speaking, it will be great if we can, because the entire process, the entire machinery, the way they have framed it, it's very helpful. So you can get your approvals within 3 days of filing the full application. So as I said, theoretically speaking, because right now the world over, the pharma companies are not able to honor their commitments. Even the pre-ordered vaccines have not been delivered to many countries. So whether we will be able to, as a country, or even if a state government wants to forge an alliance with any other pharma company, whether we will be able to tap into that pool, which is already restricted, remains to be seen.
Right. My final question, and I'd like both of your perspectives on this, is about pricing. Now, the government has said that manufacturers will have to declare predetermined prices before May 1st. The Serum Institute, for instance, said on Wednesday that it's fixing prices of Covishield at rupees 600 per dose for private hospitals and rupees 400 per dose for state governments. But from what I understand, there's no ceiling to what private hospitals or others can charge. So, Dr. Kang, do you think smaller and financially weaker states might be at a disadvantage in such a scenario?
I think a lot is going to depend on the pricing of the vaccines and the systems that states have to deliver vaccines and how much they prioritize the health of their populations. To me, 18 to 45 currently is a relatively low risk group for delivering vaccines if your goal is to prevent morbidity and mortality. So I think states are going to have to do their calculations, but the argument that you laid out about poorer states, what I've seen, and Nidhi should comment on this, is that poorer states tend to have no problems putting themselves further into debt. So whether we will wind up in a situation where it might be the poorer states that would be more willing to pay a higher price than states that have better managed finances, I think is something that we're going to need to look out for.
Is a very valid point. That is a very valid point, as Dr. Kang said, that smaller states are more willing to put themselves in debt. We have put the states which are already battling with COVID into another, juggernaut where they have to access the vaccines directly from the private manufacturers, price them in a manner that they are accessible to the people, and also ensure that the supplies are steady. It's the larger states which are right now, even high burden states like Maharashtra or even Tamil Nadu, which is getting there, Kerala, Punjab, where we have a lot of cases, and they will have to look at how to source these vaccines. And finances remain a very big question, even for them.
Yes, we've already seen the Chief Minister of Kerala, for instance, appealing to the Prime Minister to provide vaccines for free, because otherwise it will place a great additional financial burden. We'll have to see how that unfolds. But Dr. Kang, Nidhi, thank you so much for joining us today and answering all our many questions. While the announcement that all adults will now be eligible to receive the COVID vaccine from May 1st did initially bring cheer, many valid concerns about the rollout still remain, as you just heard. The most important of these is, of course, whether those who are most vulnerable will be able to have easy, affordable access to it. We'll be keeping track of that and other developments around the vaccine rollout here at ET. I'm Indulekha Arvind, and you've been listening to the Morning Brief from the Economic Times. Today's episode was edited by Shashwat Mohanty and coordinated by Nehal Chaliawala. Do send in your feedback to the Morning Brief at timesgroup.com and share the episode on social media if you enjoyed it. The Morning Brief airs every Tuesday, Thursday, and Friday. Thank you for listening and have a great day.
Avaz.com